Good morning and welcome to our webinar titled Transitioning to the New Adult Care Qualifications and Apprenticeship Standards in England Update. Thank you for joining us. Before I introduce our speaker, I'd like to explain a few things about our webinar platform to allow you to get the most out of the experience. All viewers will be in listen-only mode. However, to engage with the webinar, please use the on-screen panel. You can also adjust your audio settings using the tabs on this panel. Feel free to use the question tab to engage with us during the webinar. We expect that our webinar will be extremely popular, but our team will do their best to answer your questions at the end. After the webinar, we will be providing a recording, a copy of the slides, and a Q&A sheet to address any unanswered questions. Now I'd like to hand over to our presenter, Geraldine Donworth.
Thank you, Drew, and good afternoon, everybody. It's a fun-packed webinar this afternoon. I've got quite a lot to get through, and I will skip over some of the slides with a lot of content in so that I can summarise some of the changes that have been occurring after the publication of the revised assessment plans for the adult care worker and lead adult care worker standards. Looking at content, I'm aiming to give you an update on the new on-programme qualifications. We'll have a look at the adult care worker and lead adult care worker apprenticeships in some detail. I'll give you an update on the lead practitioner in adult care and leader in adult care standards. We'll have a look at how City and Guilds can support you to prepare for endpoint assessment for your apprentices. I'll refer to the City and Guilds terms and conditions for endpoint assessment. And then we'll have a look at an apprenticeship journey through the endpoint assessment process. There's just a brief overview of some next steps, and then there'll be the opportunity for us to review some of your questions and to provide some answers to those questions at the end of the webinar. I'm going to first look at the existing qualifications that City and Guilds has in relation to the apprenticeship standards. So we know that the level 4 standard, lead practitioner in adult care, isn't yet published, but we also know that within that there will be a level 4 diploma. City and Guilds have had a diploma in adult care at level 4 for some time now, and the QAN number is there on the slide. We're not intending to review our level 4 qualification at the moment. Prior to the publication of the revised standards and assessment plans, obviously you would know that the 42221 and 42231, the diplomas in health and social care adults in England, were included in the original standards and assessment plans. Due to the delay in the publication of the revised standards, we did reopen these qualifications, and they will remain open temporarily to enable pre-February starts on the apprenticeship standards to register for the appropriate qualifications, and also to capture those apprentices who were registered on the SACE framework, which closed in December, who didn't manage to get registered on the appropriate qualification prior to their close in December. We've also reopened the 4978 Leadership and Management in Health and Social Care and Children and Young People settings, and that's to accommodate the extension of the SACE framework, which is now open until the 31st of August. What I would say about this, though, is that having experienced a delay in the level 2 and 3 standards revision, I'm proposing to keep those qualifications open until the revised standards and assessment plans are published on the IFA website, so that we don't have a gap in provision that we've experienced in January. Our new qualifications, which now fit into the revised apprenticeship standards for adult care worker and lead adult care worker, are here. So we have a level 2 diploma in care and a level 3 diploma in adult care. We're also still working on the level 5 diploma, which will be in the revised, in the published standard, sorry, for the leader in adult care. And we're hoping to be able to provide you with the handbook in springtime so that you can start to plan for your provision in the autumn. Looking in a little bit more detail at the level 2 diploma in care, it's open for registrations and has been from January. It does cover both adult and health, adult care and health. It replaces both the level 2 diploma in health and social care adults England and also the diploma in clinical health care support. We're delighted to have the endorsement of both skills for care and skills for health for this qualification. The qualification is an optional choice in the healthcare support worker apprenticeship standard, but now a mandatory qualification for the adult care worker apprenticeship standard. Within the slides that you'll get after the webinar, you'll note that there are a number of links to various documents, and in this slide I've put in the link to the standard and assessment plan and also the qualifications pages. So we'll make sure that you've got those links and that they're active in order for you to access those documents. One of the things I'd like to draw your attention to here is that the latest version of the handbook for this qualification is version 1.1, January 2018. We did make some very minor changes to the wording around the rules of combination for this qualification. We'll have a look at those now. So this qualification is a 46 credit or 460 total qualification time size qualification with 24 credits that need to come from the mandatory group of units, and the remaining 22 credits can come from optional group B and C. I'll let you read the rules of combination there. We're also in the process of just building the unit route, registration route, which will be available next month. And in the handbook, which is on the website, the barred combination of units are detailed for you. Here's some more detail about what the mandatory units contain, and you'll see from the titles there's nothing really different at all to what we've been used to in the health and social care diplomas. As far as the units go that are optional, I've grouped these into themes, so please don't think that we've only got a dozen or so optional units. There's lots of optional units, but I've tried to just demonstrate that there's a coverage of a lot of different aspects of adult care. One of the units I'd like to draw your attention to is a brand new unit, which is around knowledge and skills for an adult care worker, and this will link very closely to the apprenticeship standard and also include some references to the behaviours that are also in the standard. Moving on to the Diploma in Adult Care Level 3, again this is open for registration. The qualification replaces the Level 3 Diploma in Health and Social Care and it's endorsed by Skills for Care. Again, we've got a wide range of optional units. It's a mandatory qualification in the Lead Adult Care Worker Apprenticeship Standard. And you will find that if you're a City and Guilds Centre and you've been offering the Level 3, then you would have automatic approval to register for this qualification. Again, the unit route will be available in March, and the link to the web page is there on the slide. For this qualification, we did make a quite significant change to the rules of combination from that which was first published. So we're now on version 2 of the handbook. What we've done is we've looked at the way that we put our optional units together. So instead of having 3 groups of optional units, we've decided to go with 2, which in the main are competence-based units and knowledge-based units. What we wanted to do here was to ensure that there was an appropriate balance between competence and knowledge, because after all, this is a competence-based qualification. So what you'll see here is that it's a 58 credit qualification, a minimum of which need to be, of 43 credits, sorry, need to be at level 3. And then from the optional groups, there's a minimum of 30 credits, 20 of which must come from option B, which are the competence unit. A maximum of 10 credits can come from group C, which are the knowledge units, but you don't need to choose any knowledge units at all. The optional units can all be competence if that's what the apprentice needs and what the employer is looking for. Again, there's a list of barred combinations of units in the handbook. Again, we see here that the themes of the mandatory units are very familiar to you, so I'll just move over those quickly. The diploma in adult care level 4, which is going to be in the standard for the lead practitioner in adult care. The details of that qualification are here. The QAN number is there for you. Rules of combination consist of 70 credit qualification. TQT would obviously be 700 hours. At least 55 credits need to be at level 4 or above, and there are 36 credits from the mandatory group. In terms of the level 5 and updating you, I have already mentioned that we've reopened the 4978 adult pathways, and as I said, and I'll say it again, those will remain open until we clearly have a standard with that, with the new qualification, the 30, 80, 50, in the actual published standard. And that's due to open for registrations on the 1st of September this year. The next couple of slides actually describe the level 5 content. So we have 11 mandatory units for this qualification. And the optional units are all there, and a learner would need to choose 7 of those from the list below. I'm sure that you're all familiar with the overview of the new apprenticeships, so I'm not going to dwell on that. I'd like to now go forward and describe to you what's happening with each of the standards. I've listed the 4 adult care standards there. You will note that underneath the title there's a red link which is called Social Care Standards. That would actually take you to the page on the Institute for Apprenticeships web pages where the social care standards are all grouped together. We know now that the revised standard and the revised assessment plans have been published for adult care worker and lead adult care worker, and the City and Guilds endpoint assessment products for those standards are now open for registration. The lead practitioner and leader in adult care standards are still deemed to be in development, and we're waiting for information from the Trailblazer Group and from the Institute for Apprenticeships as to when those standards will be published. I'm going to go in detail through the adult care worker standard here, because within the published assessment plan this time there are some changes that we were expecting and some things that we were expecting to be changed that haven't been changed. I think it's really important for you to understand where we are with that. So the first few bullets there haven't really changed. The care certificate standard is still referred to. Literacy and numeracy or functional skills at level 1 is still a gateway requirement. The achievement of the level 2 care is obviously a change thing, and that's from February. the last two bullet points, service user witness testimonies and the self-assessment, in my previous webinar, I did refer to these being taken out of a revised assessment plan when in fact they haven't been. So back in March, we were told that these two things were going to be taken out of the standards, but actually they're still in the assessment plan, and so they will need to be covered. For the service user witness testimonies, the apprentice will need to gather those in the last 3 months of their apprenticeship, and also carry out a self-assessment activity in the last month. So I'll refer later on to the City and Guilds assessment pack for endpoint assessment, which we have actually published and is available on our webpage. What we're going to have to do is to amend that very slightly to reflect these the wording in the revised assessment plan, so we'll be doing that very quickly. Again, what we'll do is we'll provide a template for the service witness testimonies and also for the self-assessment activity for apprentices. This slide here is just straight from the assessment plan. It indicates what will be covered in endpoint assessment. And the grading actually hasn't changed at all in terms of the situational judgment test. The pass, merit and distinction grades are still there and identified by the number of correct questions. The professional discussion grades are still pass, merit and distinction, and both of those elements contribute to the overall grading for the endpoint assessment. What you will notice in the revised assessment plan is that the professional discussion now has, it's indicated that it may be retaken, which was actually missing from the original assessment plan. So it can be retaken within 3 months, and or a resit is allowed in exceptional circumstances. The reason that those two are different is because if an apprentice had taken the professional discussion and been unsuccessful, then when they retake the professional discussion, their grading will be capped at a pass. Whereas if they resit because of exceptional circumstances, they would be allowed to have that as a first attempt. I'm not going to go through this in detail because the difference really is the qualification title at level 3. Everything else is the same. And again with this slide. The slide that I'm referring to now is about how City and Guilds can support you through preparing for your own programme delivery and also preparing apprentices for endpoint assessment. You'll see there are a variety of things here to support those two aspects of the apprenticeship, including our free regional networks, which you should all have received the next dates of. We've got for our level 2 apprenticeship endpoint assessment for adult care worker, we've now got a sample paper on the web page. I should say that those endpoint assessment packs and the sample papers can be accessed for those centres who are offering our endpoint assessment, and they are password protected, and the password is available on the walled garden in the administration section. So you can also see there we've got new smart screen resources, which I'll talk to in a moment. We've got an excellent maths and English offer, which I'm hoping that you're aware of. And we're also in partnership with a publishing house called Hodder, who are developing textbooks for our level 2 and level 3 qualifications at the moment. The level 2 textbook should be available in the spring, and the level 3 later on in the summer. Our new smart screen resources, The mandatory content of the qualification resources are available now to purchase, and we are topping those up with the optional unit content that we think will be popular. So we'll keep you posted on that, and if you want to have a look at that, we can put you in touch with our digital team to facilitate that. Just need to look at the timeline of events for adult care work. Again, this is the same in effect as the level 3. Looking at February, where we are now, the endpoint assessment registration is open on Walled Garden. Our endpoint assessment packs are available and our sample paper is available. In March, we're looking at the optional content for Smart Screen teaching and learning resources. We're mapping the qualifications to the standard, and that will be the deadline for the first booking for the endpoint assessment. In April, our live Evolve test for the situational judgment test will go live, and we're able to provide our first endpoint assessment professional discussion activity from June. As I said, they're the same timelines for the level 3. I think actually at this point I will just pass over this slide, as I've mentioned this previously. And again, passing over the funding changes because I'm sure that you're aware of that. Only to reiterate that the SACE frameworks for the level 2 and 3, not the level 5, that must be my mistake, closed in December, and the level 5 SACE framework is extended to the 31st of August. The level 4 doesn't have a SACE framework, so we're waiting for that apprenticeship standard to be published. Just this slide is around our payment structure for endpoint assessment and for our own programme. If I just take the adult care as an example, again, the prices are similar. The only difference is the on-programme qualification fee. For adult care, the level 2 diploma in care is £100 registration fee. For the endpoint assessment, we've actually decided to have a structure which allows a very small registration charge of £25, and the balance of that payment will be invoiced after the endpoint assessment activity has taken place. So, in effect, if a learner does the test, once they have results for that test that are entered onto our system, that is actually when the invoice will be paid. Sorry, sent to you. So we do have a registration fee of £25, and for levels 2 and 3, the remainder will be £425. The resit charges are there, £15 for an Evolve test and £410 for the professional discussion. The levels 4 and 5 standards obviously need to be confirmed. What we try to do with our endpoint assessment pricing is to support you with your cash flow, in effect, so that we need an indication that apprentices would need endpoint assessment, hence a registration activity and a registration fee. You would then make the reservation request and the event would take place thereafter. What we're trying to do with this is to support you with your the way that your funding will be coming in on a monthly basis, so that you're not having to make large payments all at once. And the resits are similar in that respect. The next couple of slides go through the content of the endpoint assessment packs. We have one for customers and we have one for our independent endpoint assessors. You'll be able to look at these in detail once you are approved to offer endpoint assessment through City and Guilds. Here we've described the apprenticeship journey in terms of the endpoint assessment. So it's a step-by-step guide. It's fairly straightforward, actually. Apprentices need to register with you. You then process their ILR. Register apprentices on the walled garden for their on programme. Once the learners achieve that and has gone through the gateway, you would then contact City and Guilds as your endpoint assessment provider. And thereafter, you would then be in a relationship with our endpoint assessment team, who will liaise with you to ensure that we can arrange the endpoint assessment to suit you, your employer, and your learner. After the event, we process the results. We would issue a City and Guilds statement of achievement, but then we would also upload the results onto the ESFA database for the apprentice to receive the apprenticeship completion certificate. As part of our apprenticeship offer, once an apprentice is registered with us for endpoint assessment, they would have access to an endpoint assessment preparation tool. This allows apprentices to actually prepare themselves at their own pace for the elements of endpoint assessment that they will need to undertake for their standard. So there's lots and lots of online content which they'd be able to access in order to help them prepare. So for example, preparing themselves for a test, they would be able to look at content, work out what their best preparation would be, and then move on perhaps to how they would present themselves at a professional discussion. We've actually put a link into a video to explain much more about the endpoint assessment preparation tool, which you'll be able to look at your leisure. Also on the next slide, it's about, well, how do you get approval to offer endpoint assessment through City and Guilds? We have a very straightforward application form, which is on our website. We have one for existing centres and one for new customers. So you would be able to use these links to identify those forms and complete them and send them back to us. We've also just published a manual for endpoint assessment services, which can also be found on our website. In terms of next steps, we're still recruiting independent endpoint assessors. We're very shortly going to be training the endpoint assessors that we have contracted with. So that's really exciting. In relation to the requirements around endpoint assessors, again, the revised assessment plan did change those, and these have been reflected on this slide. There's a host of information for you available on the City and Guilds website, and there are lots of links there for you. If you want to contact myself or my colleagues Susie Gray and Paul Rowbottom, our email addresses are there for you. And also please make sure that you're registered with our email update system so that you receive information on a timely basis. That flew, and now we're ready to take some of your questions.
Thank you, Geraldine. So if you've got any questions, please can you type them into the question tab. We'll give you a minute to do that. And when we get a few responses in, we'll answer as many as we can. So thank you for sending through your questions. We're now going to answer as many as we can.
We're starting from the top. The webinar will be recorded and will be available on our website, and we'll send you a link to the recording, so there won't be a separate script. Someone's asked, does the Level 3 Diploma in Adult Care have optional units split into competence and knowledge? Yes, it does. Can testimonies be completed by patients' relatives? Yes, they can. But I think that there are a lot of things that you need to think about in terms of the service user witness testimonies, and we appreciate that not all service users will be able to or will want to offer those service user witness testimonies. So yes, absolutely, family and relative would be good. I thought this question would come up. Well, I knew this question would come up about learners signed up to the standard in January. Will they have to do the old QCF qualifications or those starting from February to do the new qualifications? So any learner that's signed up after the publication of the revised standard should do the new qualifications. As far as those signed up in January, we've actually asked the ESFA for some guidance around this for you, because what we don't want to do is give you information that will cause problems for you in terms of your potential audits in relation to what a learner is doing and what's on their ILR and what was published within the standard at the time of their start. So what we're advising people to do, and I'm sure most of you will already have done this anyway, is to be registered with the ESFA for their provider updates. We believe that that is where the advice around those January starts will be published, but we've certainly been in touch with the ESFA, and we know that they are talking to the Institute for Apprenticeships around this before issuing some guidance. As a subcontractor, we will not be booking EPA. This will be done by the lead provider. Can we have access to the resources? I'm not sure, Michael. I think so, probably. I'll get back to you on that. I'll produce a written question, a written answer.
Yeah, we can clarify that, and we'll put it into the Q&A document going out with the post-webinar content, so we'll get back to your question there, Mike.
Details around Evolve for EPA and the slide around EPA with regards to the learner capped to pass or a reset. Okay, so I referred to a cap on a result for the professional discussion. The learner, the apprentice is actually allowed to resit the situational judgment test once. That's outlined in the assessment plan, and there's no cap on their achievement for that. In terms of the professional discussion, if a learner has been unsuccessful once and retakes that professional discussion, then there would be a cap of a pass on their result. That is detailed in the assessment plan now. Right, where we pay the £25 deposit, if the apprentice leaves prior to the end, are we still liable for the full cost? So the £25 deposit is a registration fee on the endpoint assessment product. If the learner does not go forward and actually take their endpoint assessment and leaves prior to that, then you wouldn't be invoiced because the activity hadn't taken place. The trigger for the invoice is for us entering a test result on our system. So it would be after an element of endpoint assessment had taken place. There's a question here about can you APL from old diplomas? That's quite an interesting question, and I probably need a bit more detail on that, if I'm honest, because if you're talking about from level 2 to level 2, I would wonder why you would do that. From level 2 to level 3, you would need to make sure that the evidence was at the appropriate level to go into a level 3 qualification. I think that's probably as much of an answer as I can give without more information. So, Paula, if you want to write some more detail in another question, I can provide a written answer to that. What time frame do you have for the new Diploma 4 and 5 going into the FE loans catalogue? Okay. Still waiting to hear for care level 3 to be added. Okay, so I've actually sent in the application for the diploma in care level 3. The diploma, the adult care diploma at level 4 is actually already on the loans catalogue. And the level 5, the current level 5 is on the loans catalogue. The new level 5 will have to wait until it's accredited. It's not yet accredited, it hasn't got a QAN number yet. As soon as that I have access to that, I'll make the application. What's the biggest difference between adult care and a healthcare support worker? In terms of the apprenticeship standards, I think it's actually the context in which the learner works. So with healthcare support worker, you would expect the learner to be working in a health setting. And a big difference in the standards is that in adult care there's a mandatory qualification, and in healthcare support worker there isn't. They're optional. And the other thing about those two standards is that the endpoint assessment activities are very different. The healthcare support worker, it has 4 elements to the endpoint assessment, and I'll be talking about that in my webinar next week in detail. Where do we send the gateway evidence? Okay, once you've registered the learners onto our endpoint assessment product, that will then, as I said, put you in touch with our endpoint assessment team, who will support you through the process. So they will provide information on when we would need the gateway evidence and how to upload that, or to send it, in fact. Does the care certificate have to be completed by the employer, or does the provider do this? Well, the care certificate remains the responsibility of the employer, because only an employer can award the care certificate. However, there is a role, if the employer chooses to use the role, for a training provider to support the delivery of that care certificate. Now, you might want to refer to some guidance which is on the Skills for Care website. Again, I can put a link into the answers to the questions, which actually describes what the role of the training provider is in terms of delivery of care certificate. I think many employers would welcome support from training providers in this delivery, but as I said, the actual award of the care certificate remains with the employer. What point does the care certificate on? For level 2, having to attempt the level, for level 2 is having to attempt the level 2 functional skills. Is that all 3 elements? I've put in the presentation a link to the funding guidance where this is stipulated. What it says in that guidance is that they must attempt the test, but actually it doesn't specify whether it's all three elements: writing, reading and speaking and listening. I'll refer that question to my Maths and English colleague and try and get a clearer answer for you. But going by what's in the funding guidance, it isn't clear.
Just a note from Margaret here about asking where she can find dates for other webinars. There's a few ways you can do this. If you go to our website, you can sign up for our email updates, and that means you'll be notified whenever we have new events available. The link will be in the presentation. Or you can go directly to our apprenticeship events page, and all of our upcoming events will be there with registration links and dates.
Sorry, folks, we're just scrolling down. There's a lot of questions that are the same. We're trying to find different things to answer.
We've still got some time, so if you've got any more questions, please do send them through.
There's another question there about the care certificate. When does that need to be completed? The care certificate is part of induction, so it needs to be at the beginning of the programme. The guidance, I think, is usually within the first 3 months. Can apprentices use the 4 Treble 2 quals for the new standards going forward? That again is something that we need to wait for the guidance from the ESFA to come forward through the provider updates. But I would say that if you were starting new apprentices from any time from the 6th of February when the revised standards were published, then they ought to be, or well, they must be registered onto the new diplomas. I think we've probably covered most of the question. I think the really big issue for you is that what do we do with learners, apprentices who were signed up in January? That's obviously appearing quite a lot, and the best guidance that I have for you is to refer to the provider update when it comes, and that will support you so that you don't fall foul of any audits that might occur through ESFA. That also, interestingly, is not an awarding organisation decision. We've been put in a position where we've had to have our qualifications open at the same time, which is not usual, but we did that in the to try and support providers through this difficult situation where actually you didn't have a qualification at all to register on. Someone here, I work for a mental health trust. Do you feel the adult care certificate is the best way to go? I think that's from Gemma. I think, Gemma, that rather depends on what the individual's job role is, and I think it's part of initial assessment, which is really very important. So if you were to carry out an initial assessment in terms of either the content of the standard, if you were looking at an apprenticeship standard, or if indeed it was for a qualification specifically, or outside of apprenticeships, you'd need to make sure that the job role that the apprentice or the learner does is achievable, that the qualification or the standard is achievable by what they do or what they're intending to do as part of their learning programme, and I think that's the best advice that I can give you. Some of it is about context, but I do know that you know, sometimes there's a very fine line between what people would describe as a care context and a health context. But it's back to initial assessment.
Brilliant. Well, thank you very much for tuning in today. We hope you enjoyed it. We've got another webinar coming up next Monday, which is healthcare. So if you're interested in that, please do sign up. The link can be found on our website. And we'll also be sending you through a copy of the slides, a link to the recording, and a Q&A document with all your unanswered questions on it. So thank you, and we hope to see you again soon.